Hello friends, my name is Shalini Singh Tomar and today we are going to deal with one of the mental disorder. Mental disorder means it is not a disease but it is a group of the symptom. So yes, now we are going to deal with one of the commonest symptom that person is getting after the 65 years of the age. So the disease name you can say it is not means a disease name is dementia, but in a general term we are not using, means it is not a disease, it is a group of the symptom. So in this video we are going to deal with what is dementia, what are the causes of the dementia, what are the risk factors for the dementia, what are the stages of the dementia, what is the treatment and the prevention of the dementia. So if you are interested to, so please be with the video and please see. So now first we are going to deal with what is dementia. So if like in a simple way we can say dementia is a short term loss of the memory. When a person is like unable to recognize the thing, or person is unable to remember the things, so that is known as a dementia. So now if like we will deal about the definition, so mainly dementia is a loss of the memory, language, problem solving and making a decision. So when and it is interfering with the daily activities of the life. So when a person is suffering from the dementia, so that person is unable, that person is having a loss of the memories, language as well as the unable to perform the daily task or the daily activities of the life. So now we are going to deal with what are the causes of the dementia. So mainly there is a certain causes of the dementia is there. One of the cause, like a person who is suffering from the dementia, the main like risk if you will see, so that is after the 65 or the 60 years of the age, the older person are the more prone to get a dementia, or the more person who are having the age that is 65 plus, they are the more chances or the more risk to get a dementia. Then there is a risk like a person who is like there is a heavy smoking and alcoholism. If the person is using like a more alcohol more than recommended uses, so there is a chances to get a dementia, or the heavy smoking is there, so that person is chances to get a dementia. Then family history, you know, if like in a family if any person is suffering from that dementia, so that next generation is a chances to get a dementia. Then lifestyle in the sense like if a person is not taking the quality sleep, or the quality sound sleep is not there, or like any depression, or you can say any stressful life is there, so there is a risk to get a dementia. Now we are going to deal with causes of the dementia. So mainly there is a certain causes of the dementia is there. The first cause of the dementia is like diseases. There is a certain diseases are there that are responsible to cause the dementia in a person, like Parkinson disease, Alzheimer disease is mainly the type of the dementia only, or there is a diseases like the part of the brain that is responsible to decision making and the responsible for the decision making, for the learning or the for the memory. So if like means any type of the damage is there, or any type of the diseases is there in that particular part, so there is a chances that person can get a dementia. Means like in a brain, you know, there is a certain parts are there that a specific part is responsible for the specific function. So if like the damage is there, or any kind of the disease is there in that particular part, that part is responsible to cause the part is responsible to function like a memory, for the memory and for remembering the things and for the language. So if in that part there is a disease or the injury is there, so that person is that is a cause of the dementia, or that person can suffer with the dementia. Now we are going to deal with like what are the sign and the symptoms of the dementia. So mainly there is a sign and the symptoms are the vary in a different person, because like a person who is having, because in a stages there is a different stages are there, further in this video will deal. But like the first chance or the first sign and symptom of the dementia is a memory loss. When a person is having means like a memory loss, short term memory loss, or the recent loss of the memory, like that any event was there before 1 week or before 1 or 2 day, and person is not able to remember that event. So man, that is a first sign. Then after that, poor concentration level. When we are not able to concentrate on a things, or when a person is unable to concentrate on a specific things, so that is one sign of the dementia. Then after that like unable to perform the daily activities when us like worsen, when there is a worsen of the disease is there, or when there is a worst condition of the disease is there, so that time person is unable to perform daily activity, that person will not able to eat also, that person is unable to like forgot the name, unable to recognize or remember the name of their children and their grandchildren, and sometimes that person is unable to like go to their bedrooms, they are unable to do these kind of the activities also. So dementia, the symptom of the sign and the symptom of the dementia is getting worse according to the stages. So now we are going to deal with what are the stages of the dementia. So mainly there is a 7 stages of the dementia is there. So like there is a first stage of the dementia is there, no impairment in the sense, if you will like you will notice you will not notice any kind of the sign and symptoms, and but like if the person is going for the diagnostic evaluation, so there that person will find that person is suffering from the dementia, because sometime like there is a trauma is there, or any kind of the accidental is there, or the tissue damage is there. So when a person is going for the diagnostic evaluation, so there that person is finding that person is suffering from the dementia. So this is the first stage of the dementia. Now in a second stage of the dementia, like there is a very mild changes are there. The second stage, like a very mild changes in the sense, if a person is suffering from that dementia, so that there is a not too much symptoms you will not see, mainly there is a certain or the mild memory changes are there, means a person is like sometime not able to recognize that events, but very in a mild form, not in a severe form. That next is your third. In a third, like there is a mild changes in the sense, when a person is suffering from that dementia, so you what that person, if that there is a third stage of the dementia is there, so that time person is unable to like that think properly, that person is unable to make a plans, like that a family function is there, or any kind of the plan that person have to make, so that person will not able to make the plans, that person will not able to perform some activities or the daily task activities. Means the next stage of the dementia is that moderate decline. Moderate, you know, not it is not a mild also, it is not a severe also, it is a between stage. So in a between stage, mainly like in that mild one, person is having a mild problem, like that like mild problem was there to making the decision, but here that person is having a more problem to making a plan, to making any kind of the decision, to going or for the traveling problem also. When a person want to travel also from one place to another place, so that person also, means if the person is suffering from the dementia, so there is a problem can be occur. The next is next symptom is that moderate severe decline. Moderate severe decline in the sense, they may not remember their phone numbers also. Now means it is a severe condition, it is according to that it is going to the worst condition. So mainly that person will not able to recognize their phone number. Sometimes that person is like unable to recognize their family members names, like what are the relatives names, what are the grandchildren names, that person also will not able to say. So that is your moderate severe. Then last is your severe. So mainly in a severe decline, that person will not able to go to their bedrooms, they are not remember, means where is the bedroom, where is that bathroom. So these all the daily activities, what person is doing in a daily activities, that person will not able to follow, that is your severe decline. Then next is coming, that is your very severe decline. Very severe decline, in this it is a worst condition of the dementia. If the person is suffering, that is like you can say it is a last stage and the very severe. In this person will not able to eat properly, means they don't know how to eat also, they don't know that how to go means how to perform their daily task, they don't know their names, where they are belonging. These are the conditions are coming in the very severe decline stage. So it is a last stage of the dementia. So now we'll deal like what are the diagnostic evaluation of the dementia. So like if like we'll diagnostic evaluation, mainly history collection you can do. Means in a history collection, like you can ask if the person is suffering from any kind of the disease, or like any family member is there, so that that family member is suffering from that dementia. So that is your history collection. Mainly observation, by the observation you can find easily a person is suffering from the dementia. Then there is a neurologist and the psychologist are there, so they can diagnose. There is a scanning technique is also there, like CT scan, MRI, and the many more. There is a diagnostic evaluation as there. So by that they can identify a person is suffering from the dementia or means, and what are the causes of the dementia also by the diagnostic evaluation we can find. Because if any cause, like if the person is suffering from the dementia due to any disease, so that are the one of the cause, or the person is suffering from like any damage of the tissue or the disease in the nervous system, that also we can find with the diagnostic evaluation. In a treatment, mainly in a treatment there is a reversible dementia is there and irreversible dementia is there. Reversible dementia means for the dementia that we can give the treatment. So mainly in a reversible dementia, like they are providing the treatment, medications are there, certain medications are there that they can give, and as well as like brain stimulating therapies are there, or the brain stimulating activities are there that they can provide, as well as like there is a therapies, family therapy, and the certain therapies are there that they can provide for the person who is suffering from the dementia. And if it is a irreversible dementia is there, so in that cases mainly we are managing, or the management is there but proper treatment is not there. Because in a irreversible, when there is like any genetic cause is there or any cause that we can't treat, that is your irreversible, and the reversible that we can manage. So in a irreversible, mainly like counseling we are providing to the patient, and the supportive treatment and the care we are providing to the that patient if the person is suffering from the dementia. So these are the treatment. Now we are going to deal with that prevention of the dementia. So mainly the prevention of the dementia is like a lifestyle, one of the most important factor that can prevent a person from from to getting a dementia. Like lifestyle in the sense, you have to touch with the nature, you have to do the morning as well as evening walk, as well as the regular exercises is making our self fit. So mainly like regular exercises as well as the lifestyle, one of the most common that we can prevent ourselves to get a dementia. Then after that like heavy smoking or the heavy alcoholism. If a person is doing a heavy alcoholism or the person is doing the heavy smoking, so in that case we have to stop that. Only the recommended, like for that alcohol also only there is a recommended dose are there, or the amount is there that a person can take. So or you can stop the alcoholism, don't take at all, or you can take in a small like in a small amount, so that can be prevent yourself from the dementia. Then after that like sound sleep in the sense, take a proper sleep. That is one of the important factor, that when we are sleeping properly, so that can be prevent us from the dementia. Then after that, get a sufficient diet and the quality diet. Good diet and the good nutritious diet is important to prevent ourselves from the dementia. Like we have to stop the fast food. I'm not saying that we have to stop all that fast food, but we can reduce that and we can go for the healthy diet. So these are the prevention of the dementia: regular exercise, healthy diet, then after that sound sleep, and the sufficient and the good relation, and we have to prevent ourselves. So if you like this video, so please hit the like button and subscribe my channel and share my video, and whatever the feedback and where I need to improve, so please give these all the comments, all the feedback I can say in a comment section. Thank you so much for like to give your precious time to watch this video. Thank you so much.